So as we show on the other side, we're gonna clench it a little bit. We're doing the masseter muscle. So the benefits are, for each patient is different, but we do it for the TMJ joint pain. It can be for grinding the teeth, and actually slims the lower face, the lower, the from this area down, slims the face. It gives more V-shaped, so it's for contouring the face as well. It's important, and some patients do it for that reason. Here we're gonna do injection for the masseter muscles. Clench your jaw a little bit. Okay. I already, as you see, I marked the anterior border of the muscle so that I don't go any medial to that. And I ask the patient to clench because that will bring the muscle out, and I have better chance of hitting the body of the muscle actually.